about Dianabol, what was it, the 70s, 80s?
40s and 50s.
40s, 50s. So yeah, back in the 40s and 50s, the Soviet Union and ourselves, the US, were in competition, which we would continue all the way into the space race and the Cold War and yada, yada, yada. So back then, the Olympics, that was the competition that was going on between us and the Soviet Union, not to mention China and everybody else. So what happened was they started giving their athletes, the Soviet Union started giving their athletes testosterone and things in that class, and gave them an advantage against us. So we got wind of this, and we had a physician, Dr. Ziegler, and he came up with a compound that we now know as Dianabol. So Dianabol gave the U.S. now had a way farther unfair advantage over at least the Olympic athletes did. And this was created specifically for Olympic trials. So there wasn't a lot of pre-testing. This wasn't something that they took a lot of time developing. They saw the benefits. They said, wow, this is a really powerful androgen. So they pushed it out. They gave it to the athletes. All right, go. We got to beat the Soviet Union. America's got to win, at any cost. And so now we're starting to see some of the long-term effects. We also know more about the endocrine system now, and it basically, Dianabol is known as one of the most powerful steroids, because it is one of the most powerful steroids, except with high reward, you've got super high risk. And this is one of the steroids that I think Dr. Jenn would probably agree has one of the highest ratios for side effects, and some of the most extreme side effects, and some of the most readily seen side effects, as in you see the side effects very quickly. Right. So I'll let her break down some of the science behind what Dianabol is, or Dbol, as some of you guys know it.
All right, so Dianabol was actually one of the first and only androgens that was created specifically for performance enhancement. Most of the other things that we have was created to treat conditions, and then they found out, the side effect is more muscle gain, less, body fat, et cetera, and then it gets, moved from its original purpose into bodybuilding, athletic performance, that kind of thing.
Usually when they find out there's a nasty side effect.
Right, exactly. So, and this one, it was specifically, as you just mentioned, created for this purpose. So the difference between this and like testosterone, which is also androgen, is it has an extra double bond, and it also has an extra methyl group. What that ends up doing is it makes it a slightly different compound than testosterone. In the body, it still binds to androgen receptors, the same receptors that testosterone binds to, but it goes to these receptors with less affinity. So what that means is it doesn't bond as much as testosterone does.
Okay.
But the benefits to this over test and bodybuilding is you also don't get it bound to the sex binding protein floating around. So this actually has more component that's free in your blood that your body can use. So that's why when you take this, people see massive gains muscle-wise. It's a bulking steroid. People, if you're into bodybuilding, within the first 2 to 3 weeks, easily you can get 20 pounds like that. Right. So, and it's muscle, it's nothing other than muscle. Right. So that's, that is why this is one of the most popular ones out there, because it bulk instantly. In your body, it does a lot what testosterone does, which also means that it can lower your LH in your body, which will make testes shrink and that kind of thing. So this is another one that you got to balance with HCG. Obviously, Dianabol is no longer on the market in the United States. Other places in the world are still doing it, but we can't make it here anymore. So if you ever get a physician trying to prescribe this, then they're probably not a real physician. But you know, it's just something to know. If someone says it's manufactured in the United States, it's a lie.
Yeah. It's not even legal.
Right. This is one of the only steroids that actually you can take orally. Because of the extra bonds, it can survive in the stomach and doesn't get completely broken down. So a lot of them, you know, you take orally and your body's just digesting it and you think you're getting gains, but you're not.
Just peeing it out.
Pretty much, yeah.
Just peeing down broken down bonds.
Pretty much.
Yeah.
So this one you actually can take orally and it works. Downfalls of this. So we talked about like the huge muscle gain and the good effects.
The high reward. Now let's hear the high risk.
Yes. So this one actually, with the extra bond, you get a similar component to testosterone, but it's more powerful than testosterone. The reverse of that is aromatase will turn this into a estrogen, estradiol, and it is a more powerful estradiol. So
how much more?
About 500 times more.
500 times more powerful than
estradiol.
Than your body's natural estradiol.
So
wow.
When this gets converted to the methyl estradiol in your body, like overnight, gynecomastia, water retention, all these nasty side effects that, you know, bodybuilders have to deal with taking exogenous testosterone and turning it estrogen, but this one happens very fast.
For guys that don't know what the term gynecomastia means, that's man boobs.
Right.
Man boobs, big puffy nipples.
Yep, and sore.
And sore, yeah.
And the water gain can be significant, and that can be very agitating because you work so hard, and then all of a sudden you wake up and your abs are gone because it's over, you know, this layer of water is over them.
Yeah.
And that goes for all your muscles. But other side effects, like...
So that's where the term water weight.
Yeah.
Oh, that guy's all water weight.
Yep.
Yeah.
Yep. So all the anabolic steroids are hard on liver, and this one's no different. You know, it can cause all sorts of liver stuff. So please.
Well, being high in water weight will also increases your blood pressure.
Yes.
Correct.
Yes.
So that raises your chance of heart attack.
It does.
And I guess stroke also.
Stroke,
yeah.
Heart attack, all that kind of stuff. You know, another one that I guess really isn't talked about much is erectile dysfunction. High blood pressure.
Yeah.
Long period makes erectile dysfunction. Which,
yeah. So real quick, what would be the, you said it's 500 times the amount of estradiol, so your estrogen is extremely high.
Right.
Right? So just real quick, explain that a little bit, why, like the pros and cons, and what does that mean if I have really high estrogen on a guy?
So really
what
high.
Can I expect?
Really high estrogen, all the work that you put in is going to be hidden really soon, because not only are you going to gain water weight, you're going to get an extra layer of subcutaneous fat, and it's going to cover all the gains you've seen. So instead of just looking ripped and cut, you kind of look pudgy. You know,
right.
It kind of takes the ripped look and turns you kind of pudgy looking. And we've seen people who, you know, we've seen people in the gym and stuff who, you know, are super strong and big and ripped underneath, but you can't actually see the cutness and the shredded look. You know, other things other than looks that happens is, again, erectile dysfunction is big. Libido goes down the drain. You know, mood can really drop dramatically. We've had several patients that depression and stuff.
If you're a guy and you've got 500 times your normal estrogen,
you're basically a PMSing woman.
Yeah, you're a woman with PMS. You're gonna feel it. You know, you're definitely gonna feel it. And other people are gonna know that. You know what I mean?
Yeah.
They're gonna see that it's a noticeable change in your.
Well, it's gonna suck because you'll be in traffic and someone cut you off and you'll start yelling and then cry.
Yeah.
You know. So.
You're crying with your girlfriend watching the movie Ghost.
Pretty much.
Oh God. Quick little disclaimer. We are a concierge physician practice. This is not. People need to understand. We're not telling you to do this drug. We're not telling you not to do this drug. We are simply stating the facts of this drug through the research that we have done and giving you a summarized version of the answers that we've found. So this is not considered a medical consultation. No doctor in the U.S. would prescribe this. So even
we are no different.
You know, I just say that because some people, all they hear is massive gains. That's the only thing. They watch the entire video and that's the only thing they're going to hear is massive gains. I'm going to do it. So we just need you to know that as a physician service, we are not sanctioning the use of this drug. We're simply putting the information out there, and this is totally objective.
My goal is to educate people, because whether I say do it or not do it, people are going to do it. So
Right.
I want to educate people so they can actually
At least you're making an informed decision. Yep.
Do the best you can with something that's not, within the legal constraints of at least the United States. So.
Yeah, and any good doctor would tell you the same thing. If you went into their office, they might not be as understanding as Dr. Jenn and I, but maybe they would just tell you don't do it. But I think this is better than taking that approach, because it doesn't matter. We personally think it's really unsafe, but that doesn't go very far. If I'm asking somebody about something and their qualifying statement to me is, you're wrong for thinking that, don't do that, you don't know what you're doing, you don't know what you're talking about, you're accusing me.
Right.
And you just turned me off from whatever you had to say. So that's why we just want to keep it objective.
Right.
We don't have a dog in this fight. It's your body. You're going to do whatever you're going to do with it. So here's the information.
So at least be informed.
Yeah, absolutely.
Regardless of what we say, it's your decision. So.
Yeah, and feel free, if you want to subscribe to our podcast. We go over some of this stuff more in depth. If you're driving to work, you want to listen to an hour and a half of Dr. Jenn and I jabbering back and forth about testosterone and all that. Feel free to subscribe and comment and ask us any questions, and we'll get with you whenever we can.